Good afternoon, everyone. Here we are welcoming Ready, Willing, Able, Rethinking Community Overdose Response Capacity in Dearborn County with Chris Henderson. I'm honored to be able to introduce Chris and all of the wonderful work that they've done. Here with Community Overdose Response Capacity, in this capacity, they specialize in localized opioid education, naloxone distribution programming, and Chris has developed and deployed trainings at the local and state levels to build community capacity using data and technology in overdose prevention. Most recently, Chris was an NPI on a NIDA STTR Phase 1 feasibility trial, during which they developed and tested the Citizen Opioid Responders online naloxone training program in 5 Indiana counties. Can't wait to hear about the excellent work that you've done. Thank you so much for serving our communities. And please join me in welcoming them.
Thank you, everyone. I'm excited to be here to talk to you about the Dearborn County CORE initiative that we've been doing over the last year. For those of you that may not know, Dearborn County is located in the southeastern part of the state, right across the Ohio River from Cincinnati. And like many Indiana communities and also communities across the country, it has been impacted by the opioid crisis. In fact, when we began talking about bringing the CORE program to Dearborn, the health department officer shared with me that on any given year, they have as many as 12 overdose deaths. And so they felt this was really impactful to try to address the opioid crisis in their community. So at the heart of this work is really this idea of like, how can we engage more people in overdose prevention? And also, how can we use technology to connect people in real time to possible overdose medical events happening? And so I'd say we can all agree that the COVID pandemic has really exacerbated the opioid epidemic. And whether it's a heart attack or a overdose prevention or an overdose, thinking about how we can use technology to connect people in real time is really important. So going back to the COVID pandemic, I think it's really challenges to think about how we as community members innovatively think about access to treatment, overdose prevention efforts, and in more innovative ways. And so taking it from there, I believe one of the ways in which we can engage more of the public in overdose prevention is through the CORE program. And one of those core components of this is thinking about Pulse Point, which is something that Dearborn County has adopted, and also 17 other Indiana communities have used in this state. So I want to talk first, before I get into the CORE program, I want to talk a little bit about that technology piece, and then talk to you about how we developed the CORE training program. So the CORE, Pulse Point is a medical app, and I am not a stakeholder. I don't have any shares. I can only tell you it's a piece of technology that's being used in 17 Indiana communities and in 14,000 communities in North America. Its sole purpose was designed to connect persons like you and I to medical events happening in public places in our community, so that in real time we could receive a medical alert and be walked right to the person in need of help. We here in Indiana are the first to actually use this technology in overdose prevention efforts. And so thinking about that, again, going back to whether it's a heart attack or it's an opioid overdose, minutes really mean the difference between life and death. And so we see this as a real viable way in order to increase the chances of reversing overdoses in our community because we're connected in real time. So having more people trained in CPR, rescue breathing, naloxone administration, and connecting them in real time, it increases the likelihood that we will reverse overdoses, and it increases the likelihood that people will be connected to care. So let me transition now to the CORE program itself. As Sonny was saying, we actually developed this training program as part of a NIH study in 2020. And when we began conceptualizing this, we thought it would be important for us to know what's on the market. And so we began to look at online naloxone training programs that were being offered And what we realized is that there was a great deal of variability. You could quite literally get trained in 5 minutes, 2 hours, and everything in between, which meant time was a variant and content varied greatly. But as we think about engaging the public in overdose prevention, we realized that we needed to rethink overdose education. And what we also noticed in all these trainings that we looked at is they focus pretty much solely on knowledge transfer. And when we're looking at the public, we realized that most naloxone training programs focus on 3 groups: the persons in active use, friends and family members of persons in active use, and also professional groups. But because we wanted to engage the public, we realized we needed to meet people where they were at and think about that they were going to come to our training with varying degrees of understanding of what SUD is, varying degrees of understanding of why and how we use naloxone, misbeliefs, misperceptions. And so we thought we needed to really ground this training in science-based adult learning principles, including Bloom's taxonomy, and make it engaging in a way that we transcended knowledge and also tapped in people's feelings of self-efficacy. We wanted people to leave this training maybe not knowing anyone that's currently struggling with substance use, but we wanted them to leave this training feeling more capable, confident, and ready to actually be engaged in overdose prevention in our community. So to do that, we created knowledge checks, interactive activity like drag and drop, pop out information, video and auditory audio activities that walk the participant through the learning process. And again, the whole thing was to make sure that people took something away, they increased knowledge, but they left the training feeling more confident, capable, and ready, and we wanted to be able to test that. So when I asked the health department, why do you want to adopt this training program? They mentioned a couple of things for me. They said, first, we know the product. We know that it's been tested. But we also know that most of the trainings that are offered in our community do not address 2 important things: Good Samaritan laws and scene safety. And as public health professionals, we want to make sure that we diminish risk. And this is a way that we see that can be done. Additionally, they saw this as a way of serving the public better. As a rural community, they have a small staff doing great things. But when the public shows up at your office and you don't have staff available to in person share, teach them naloxone training, then they felt this was a way to provide better customer service with a better product. Additionally, they saw this as convenience. This is a highly stigmatized topic, and they wanted to make sure that people who came to their office, learned about this, could go home, be in the comfort of their home, on their tablet, on their laptop, and they could feel comfortable learning about overdose prevention. And then finally, they saw this as a good use of outreach dollars, so much so that the second year, they funded it with opioid dollars. Now, I'm a firm believer that even though those are all good reasons to adopt, successful implementation is going to really hinge on who you know in the community and who is supporting your efforts. And so we really felt like as soon as I was approached, I began to brainstorm with the health department, asking them, who do we need to be at the table to get their endorsement? And so that led us to talking to law enforcement and other first responder agencies, systems of care, mental health, treatment, persons with lived experience are all at the table. And I think that I can show you here that we've been pretty successful at who we've got at the table. So this here shows you that we have law enforcement, systems of care, we've got treatment providers, we've got peer recovery, we've got actually industry, catalytic cares, and also hospital system. And so we've been pretty successful in the coalition, the gatekeepers of the community joining this cause and helping us get the word out. All right, so once we knew who was going to be at the table, we then had to think about, well, how are we going to disseminate this information? What's the best way, right? It's a rural community. Is digital going to be enough? Should we do print? Should we do, flyers? And so we began to work on that idea, and I took these to IU Studios where we were able to put together what I think is a pretty effective campaign. So this campaign actually really, I think, highlights collaboration, coordination, and boots on the ground strategy. While our mission was to bring the core program to the county for anyone residing or working in the community to take it, what we realized is that we also needed to have the focus of our campaign be local leaders and persons living in the community. And so when we looked at press, we did digital and print, we did local and statewide. We had law enforcement, the health officer, and other people that were interviewed for those pieces. That way, residents and community members recognized their leaders supporting this effort. We also put together videos. And so we have two videos, one that features the health department and their staff talking about this program, and then another video that actually talks about a young man sharing his story about losing his father. Again, these are local people talking about their stories and the importance of this program. In addition to that, we had social media images that were tailored for platforms such as Facebook, Instagram, Twitter, LinkedIn, and we created multiple website images that could be shared across agencies and placed on people's websites. One of the things that I took away from this is that if you're a small nonprofit or you're a big industry in health, your resources for marketing are going to be vastly different. And so knowing that, I put together a resource guide that helped whoever you were on that continuum to have the tips you needed, the talking points, the hashtags laid out for them so that when they did go to push out information about this program, they'd be able to do it easily and have talking points to do it. So my goal was to make it user-friendly. And right now I'll share the video with you of the health department.
CORE stands for Citizen Opioid Responder.
CORE is an opportunity for you to get trained in Narcan usage and potentially save a life.
The training only takes 20 minutes to complete, but you could end up giving someone another 20 years to live.
In Dearborn County, we have a serious problem with opioid overdose.
There's a lot of stigma around Narcan, but it's not just for people in active use of opioid. Young kids can get into prescription pills if they're not locked up. The elderly can accidentally take multiple of a prescription. A lot of party drugs are laced with fentanyl, and even one dose can be fatal.
There have been dozens of these deaths over the last years, and I think that they've touched many families in the community. That's why I'm excited about this program, which has the potential to save some of these lives. Clark County piloted this program, and they saved 5 lives the first year.
CORE is very important to me because I had a very good friend that passed away of drug overdose in 2014. She was my best friend for a number of years. We rode horses together, trail rode together, we put in paint together. She was a full-fledged country girl, nothing on what you would think of a typical drug addict would be. She was on the road to recovery. She was getting very involved with the church. She had really surrounded herself with different, more positive people. And she was also living with her aunt at the time. So if her aunt had been trained in CORE and Narcan delivery, she would still be here because EMS did not get to her at the time.
In rural areas like Dearborn County, response times are longer than they are in larger cities where there's more resources available.
To participate in this program, you just need to complete a 20-minute training and learn how to administer Narcan. Then you'll actually be able to carry Narcan with you. You'll be notified by an app on your phone if there is an opioid overdose nearby. You can be a first responder and show up at the scene and administer Narcan yourself. Members of CORE are protected from liability under the Good Samaritan law.
In a perfect world, there would be no overdoses, but we don't live in a perfect world. We are all part of this community. We need to take care of each other, and this is one of the ways that we can do that.
Get trained, save a life.
Please get trained in CORE and save a life.
Take the time, get trained, and help us save lives.
For more information, go to the following website or contact us at naloxone@iu.edu.
Okay, so now that you've learned a little bit about how we got here, so how it was developed, stakeholders, marketing, now I'd like to talk to you about our first year outcomes. And so I'm going to first talk about participant knowledge, attitudes and perceptions, intentions, and then I'll wrap up with training and feedback. So in our first year, it's been a pretty big year. We had 155 people that completed the training, and of those, 68% actually worked and resided in Dearborn County. So what's important to know here about knowledge comparison is that we're actually looking for correct and incorrect responses. We want to see increases in correct responses, decreases in incorrect responses. And so what you see here is that, first, what's important to know is, of the 155 people, we had pre and post tests. Not everybody took a pre-test, but everybody had to take the post-test. We were able to confidently match the responses of 66 participants of pre and post. And so what I'm going to share here with you is those matched responses. And so what we see here is that many of the program participants, they began the core training knowing that slow and shallow breathing and loss of consciousness were signs of an opioid overdose. However, only half of the participants knew that core, before taking the core training, that very small pupils was an indicator of an opioid overdose. That increased to 94% upon completion. We also see in figure 2 here that the number of participants incorrectly identifying fits and convulsions decreased from 35% to 11% following the completion of training. Here, most trainees knew how long Narcan takes to start having an effect, so 85%, and that increased to 99% at completion. And then in figure 4, you see that only 1/3 of the trainees, so 33%, knew how long Narcan lasts before taking the core training. So that increased to 92%. All right, so I'm going to talk a little bit about attitudes and perceptions, and this is different from knowledge. In attitude and perceptions, we're not measuring correct or incorrect. We're actually measuring a degree. So how does the person feel about something? And so, for example, again, we're not measuring confident or unconfident, but instead we're asking them to tell us how confident they feel. So among the 66 matched responses, there was increased perception that rescued breathing is an effective way of managing an opioid overdose. You see an increase from 26% to 57%. We also identified that after the core training, participants were substantially more likely to strongly agree that they could effectively reverse an opioid overdose following the completion of training. We also found that participants were significantly more likely to report being very confident in administering Narcan intranasally compared to pre-test. And then participants were also significantly more likely reporting being very confident in administering rescue breathing. Now, difference between what I've been talking about, we're talking about intentions. The whole point of this program is to engage the public in overdose prevention efforts. But to know whether or not people are going to actually do that, we need to study intention. And the reason we do that is because behavior theorists have found that if you study intentions, you'll understand what people might do, what actions they might take. So what we see here is that a large percentage of core trainees already intended to carry Narcan on their person. And what that tells us is there was a high baseline. So statistical comparison might have been affected by that. But it's important to also note that we did find statistical significance here in that 95% of participants reported a 5 or greater intention, so 7 is extremely likely to carry naloxone on their person. Intent to respond to nearby overdose was also high, and in this case there was no statistical significance between the pre and post. We also found that 39% of participants knew what pulse point was before taking core training. We're not surprised that increased to 99% because in the core training we actually have a module that guides the participant through learning about pulse point itself from beginning to end. So they literally learn about it and they learn how to download it to their phone. What I didn't include here is a figure that indicates that between pre and post, 14 people actually downloaded the app for the first time on multiple devices following the completion of training. So now I'd like to turn our attention to training feedback, which is very different from the data set that I just shared with you, where we had matched pre and post. This survey was only administered to people at the conclusion of the training, therefore the data represents responses from all 155 people. Overall, the responses were extremely positive. We find here that 138 strongly agreed that the training was worth an investment of their time, so 94%. 136 strongly agree that they would recommend the training to someone in their community, so 93%. 136 strongly agreed that they were satisfied with the educational content that was shared in the training, so 93%. And 126 strongly agreed that the length of the time was appropriate, 86%. 127 strongly agreed that the technology used in the training was appropriate, so 88%. And 136 strongly agreed that what they learned from the training would be useful to respond in an opioid overdose at 93%. So in conclusion, we've had some really positive outcomes in this first year, which mirror what happened in the study that we did in five counties. So the outcomes are extremely positive. We show increases in knowledge in our Dearborn County project. We have significant improved attitudes and perceptions at post-test. And we have evidence for improved behavioral intention, such as they carry pulse point and naloxone in response to pulse point alerts. So to wrap it up, I'll take questions from you. Do you need a mic? How was it funded? So in this case, for Dearborn County, it was funded, the first year I think they had COVID dollars. The second year they went in front of the abatement center committee and they used opioid settlement dollars for this second year, which we just started in August. Yes.
Chris, I was curious about the stat that said, like, it seemed like half the people going into the training intended to carry naloxone. Do you think that, how would you explain it? It seemed high, because, like, wow, a lot of people are, like, maybe it's because they intended because they wanted to be trained in Narcan. I'm not sure how you would explain that.
So it might depend on who the organizations did their outreach to. So if they were, doing it as colleagues that work at the health department or at the hospital or at peer recovery or mental health and treatment, that may explain the high. But we also saw statistically a significance in that a majority between 5 and 7. So extremely likely, was still statistically significant in its finding, even though there was possibly a ceiling effect. Yes?
You may have answered this, but does the app allow you to track how many of those people actually use it?
So keep in mind, the app itself is the technology that we're leveraging. And so just to split it out a little bit, we can't tell that. The health department, the first responder agency, so the 911 call center, they hold the subscription to PulsePoint. And they bought it, I'm sure, because it's a rural community and they have higher response times and they were thinking about cardiac arrest and medical events in that way, right? They have numbers that they get every month as far as how many people use the app, how many responses happen. But beyond that, like, there's no tracking if people get into treatment or if they went to the hospital or anything like that.
So you would really just expect to see the number.
Yeah, so I think, and that's a good question, and I agree. Like, what we would hope to see, right, is a decrease in fatal overdoses in the county because we have more people engaged in overdose prevention. There's someone behind you. Yep. Yeah, so how PulsePoint works is when a county decides to invest in this technology, they work with PulsePoint. PulsePoint works with their 911 call center and interfaces with one another. And so one thing to keep in mind and why this is so effective with overdose prevention is that generally when people call into 911 for a cardiac arrest or an overdose, they're saying the same thing. The person's not breathing, they're unconscious, they're unresponsive. So in all likelihood, we have people that are using the PulsePoint app already out in the community that are responding to overdose events, but they don't know it, right? Because the app is saying CPR is needed. But when they arrive on scene, right, they find that in fact this is an overdose. So they can do rescue breathing and they can do CPR, but if they don't have Narcan on them, then that's problematic, right? And so what we find in rural communities is that laypersons are actually responding like 2.5 minutes ahead of first responder agencies. So if we get more people cross-trained and carry, then we increase the likelihood that reversals are happening because they have what they need on them to at least administer it. Any other questions? Yes? Yeah, so for the core program itself, right, what I can tell you is what we've done in the second year. So for Dearborn County, their second year cost was $15,000. That included the data collection, so pre-post stuff, a little bit of my time to help in the community, and also an evaluator's time to help me crunch the numbers and write the reports, and then a web engineer that manages our website. Yes? Yeah, so year one was a little higher. In Dearborn County, it came in at $25,000. That was a lot more of my FTE. Also, we built the website and the evaluation tools and stuff, so that was a little bit higher. If our management, our fiscal department knew I was talking numbers, they would be not happy with me. But the reality is this is just where it's at, right? The health department had the COVID dollars in the first year to cover that. The second year, they used the opioid settlement dollars to cover. And quite literally, I think my FTE on this second year is like 8% compared to 20, right? So it's considerably less because I did the legwork in year one. Yes?
Speaking of the health department, you worked in the health department, right? The health department just got a huge boost in funding for the next 2 years. So if you're interested in this program, you have to go to your community, you have to health department.
I gotta take her on the road with me. Anyone else? Any other questions? Yes. Yeah, so just keep in mind, I don't work for them. But what I can tell you is, because of the community partners that I do work with, they're getting naloxone from the state. And so I'm working with strategic partners in communities that in many cases are just giving free Narcan out. And so there's no cost to the community at that point, right? The good news about this is that everybody that takes the core program gets a certificate of completion at the end. And because we're building strategic partners, it's baked into this, then those certificate of completions are being recognized by the health departments and other community partners. And so people don't have to take a face-to-face version of training when they show up and request a Narcan. The other thing is that when you go through this training right now for Dearborn County, we've identified naloxone box locations in the community. We've identified the vending machine in the Sheriff's Department's lobby that's available 24/7. So there are alternative ways. In addition to that, the health department received some additional funding recently, and if you, like in Dearborn, if you were to complete the training, you can upload your certificate to their county website, and they will mail the naloxone to your home, which is a real upside to folks that work or folks that are older, to have it shipped to your home. I do know that with the over-the-counter situation now, we have a perceived accessibility. My concern, and something I want to study over the next couple of years, is whether or not this accessibility in over-the-counter is actually a barrier. Because cost, I wonder if cost is a barrier. It's at $45.99, I think, in CVS and Walgreens, which is better than $75 a box, right? But I do wonder about cost. And I also think about placement. If any of you have been to a Walgreens or CVS looking for Narcan, just do the thought experiment with me. Have the experience, go there. You'll find, if you go to a CVS, it's still in the pharmacy behind the counter. That's a bit problematic. First, in many cases, there's no flyer that informs the public that it's there, so they don't know to ask. But now you have to ask for it. And so if you have any type of comfortability issues around this topic, if you're uncomfortable, this is a barrier, right? If you go to Walgreens, in some Walgreens, it's on the shelf outside of the pharmacy, which is better because you can pick it up, not go through the tutelage, right, of how to use it, and take it to the front and buy it. But again, no flyers, no type of information. Yes? I'm sorry, I didn't hear the question.
How did you market to the people who took the course? Like, how did you get your students? How did you market to your students?
Okay, so again, through the campaign, right? So we had a multi-approach. We have multiple stakeholders. We had flyers. We had digital ads that could be pushed out and shared. But basically, we did speaking events and we did press, right? So we tried to saturate on multiple ways to get the message out to the community. Just last week, we had the Addicts Wake in Dearborn County. before the viewing of the film, we had the Dearborn County Health Department video. We had flyers at the event as well. So that's one. In September, I actually went to a Systems of Care meeting there in Dearborn County where we have a hodgepodge of folks, different stakeholders at the table that learned about where we're at in year one. Again, they're taking flyers, they're getting digital and email reminders, and they're passing that off to their peers and their colleagues and their community partners as well. I'm sorry? No, in Dearborn County. So that's the thing, is that their 15,000, their initial 25,000, that just simply purchased time and a product, right? The product being the report, the data report, the website maintenance, things like that. But we actually did not charge for access to the training. We basically, what do we need to make this available, to make it successful? That was a little bit of my FTE, the web engineer, the evaluator. So there is a charge, right? If someone were to come to us and say, look, all we want is evaluation. We just want the pre-post, a place for someone to land to take the training, then the cost structure will change because then there'll be something different. But we haven't had that experience yet, right? Any other questions? Yes.
Is Narcan training happening for any of the high school level that you know of? Anywhere?
I know that Clark County was recently successful in getting into the school. I don't know if it's middle or high school. I know that took them 5 years. I also thought I recently heard that Overdose Lifeline was the recipient of some funds to develop some high school or middle school education around this, but I don't know the extent and I don't know where that's being piloted. Any other questions? Comments? Okay. I'm here. Thank you.